All right, we are recording now. It is January the 11th, 2021. Cardiac AMP. The students are working on this poll. If you were not live, then you didn't get to see the poll as far as being able to manipulate the poll. It's not for a grade. It's just trying to see where the students are with the information. I will scoot it so people that I'm recording, if you're at home, you can see these and you can pause it and answer the questions yourself. Okay. This is just a poll to see where the students are with the information. There's no right or wrong right now. It's not showing me who got it right or who got it wrong. But you can work on these and you can pause them if you're watching the video. It's just 10 of them. Okay. So you'll go ahead and do those 10, then pause me while you watch them and look at them and think what you think it is, and then keep on going with the video, and we will have gone over it as well. All right, so just got 9 out of 10. You almost finished, Brittany? Okay, we're getting ready to go over. 10 out of 10 has now been submitted. All right, so make sure you pause it if you are watching it from home for the first time, so that you don't get the answers right off the bat and you don't know if you knew it or not. Okay, this is for your benefit. All right, here we go. Shatara, you can cut your camera off if you want to, since you're in the classroom. All right, so let's go over this poll. Number 1, the cardiac muscle tissue is referred to the, everybody answered. See this? I don't know if y'all can see my screen or not. Let me share it and see if you can see it now. All right. Make it bigger. All right. The cardiac muscle tissue is referred to as the myocardium. All 10, see, it was 10 people that did it. All 10 answered this question. So it was 100% of the class answered.
All I see is...
Huh?
We can't see it.
Oh, okay. Let me see. You see it now?
No.
Well, let me see if I can do this. Might not let me do it. If this don't work, then we just have to go over it. I'm just gonna say it, and you're still showing edit meeting polls.
Yep.
All right. Well, I'll just have to say it then. Let me stop the share. The first question was the cardiac tissue, muscle tissue is referred to the myocardium. So if you got myocardium, you were correct. All right. Number 2, the inflammation of the heart lining or the sac is called pericarditis. Remember that the pericardium is the sac that the heart sits in. If it becomes inflamed, it's pericarditis. Okay. The other choices were epicarditis, which is the outer layer of the heart. Endocarditis is the inner layer of the heart, right? And pericarditis. Those are the 3 choices you got. And in pericarditis, you have to know that the pericardium is the sac that the heart sits in. Okay. So if that sac becomes inflamed, that's called pericarditis. So let's see. 60% of the people who were taking it got that one right. 60% of the class, a little bit more than half. Okay. Number 3, blood returns from the lungs during pulmonary circulation via the blood returns from the lungs. So when the blood goes to the lungs, it comes back from
pulmonary veins.
Pulmonary veins. 60% of the class got that one. The other choices were pulmonary artery, aorta, and vena cava. The answer is pulmonary veins. When the blood returns from the lungs to the heart, they come back via the pulmonary veins and dump into the left atrium. All right. Number 4, the pacemaker of the heart is known as the SA node. SA node. The sinoatrial node, SA node. The other choices was the AV node or the bundle of His. Answer is the SA node. It's called the pacemaker of the heart because it fires at a rate of what? Anybody? The SA node.
60 beats per minute.
60 to 100. 60 to 100. It fires at a rate of 60 to 100, which is the normal heart rate. So that's why they call it the pacemaker of the heart. Okay. If the SA node does not fire or has issues, then the backup pacemaker is the AV node. And it beats about 40 to 60. Okay. About 40 to 60. So it's going to be more than likely be a bradycardic issue. Okay. All right. Number 5. The blank circulation involves movement of blood from the right ventricle to the lungs. Which circulation is that called?
Pulmonary.
Pulmonary. The choices were pulmonary or systemic. 70% of you got it right, 30% got it wrong. The other choice was systemic. Remember, systemic is when the blood goes from the aorta to the body, right? That's the left side. And the right side, which is the pulmonary side, involves the movement of the blood from the right ventricle into the lungs. Okay, right ventricle into the lungs. What structure takes the blood from the right ventricle into the lungs? What is that structure called? To the lungs. So what structure is in between the right ventricle and the lungs? Pulmonary artery. Pulmonary artery. Pulmonary artery takes the blood from the right ventricle into the lungs. All right. So it's not going to get any easier, guys. So I'm hoping that you're studying, you're reading, you're attending, you're watching live, because like I said, I encourage you to come live or watch it live, because this is not a watch or recording type of class. All right. All right. Number 6. This was one you would have to have gotten from the book. The blank divides the heart into the right and left sides between the atria. The blank divides the heart into the left and right sides between the atria.
The interatrial septum.
Yes, the interatrial septum or septum. 60% of you got that right. Okay. The other choices were the ventricles or pulmonary artery. And so some people did. I had one person say pulmonary artery, 3 people said ventricles, and 6 people said interatrial septum. Something you would have gotten in the reading, but it's definitely not the other 2. If you're thinking the other 2, you need to really, really be paying attention to that. All right. Number 7. What is the job of arteries?
Pumps blood away from the heart.
Carry blood away from the heart. 6 people said that. 3 people said carry blood to the heart. And then 1 person said gas exchange. Okay. Carry blood away from the heart. That's the job of the arteries. They carry blood away from the heart. Okay. Veins carry blood to the heart. And arteries carry blood away from the heart. Okay. Number 8. QID. What does QID mean? 4 times a day. Good. 4 times a day. Some people said the other choices were 3 times a day or twice a day. QID means 4 times a day. 60% of you got that one right. All right. Number 9. The 2 AV valves. Those are atrioventricular valves. The 2 valves that separate the atria from the ventricle are the what? The choices are bicuspid and tricuspid or pulmonary and aortic.
Try and by.
Try and by. Try and by. Those are the only 2 valves that separate the atria from the ventricle. They're called the AV valves. Those are called AV valves. And number 10, which of these is a deadly arrhythmia?
V-fib.
V-fib. That's the only one deadly in that list. Nobody said A-fib. That's good. One person said A-flutter. Okay, no, the atrial rhythms are not deadly. Okay, PVC. 3 of y'all said PVC. Now, PVCs are not deadly. They can be dangerous if it's multifocal, like if there's a bunch of them back to back, or they land right by the T-way, but overall, they're not deadly. The only one deadly in this list is V-fib, which is ventricular fibrillation. That is when the ventricles are just twitching. Okay?
What was number 9?
The 2 AV valves. The 2 AV valves, which are atrioventricular valves, are the tricuspid and bicuspid valves. Now, V-fib, which is when the ventricles are just twitching, what are those? What does that say it's the same of? Okay.
Asystole.
Asystole. Same thing. Now, you're able to see my results now? Okay, see, I'm just learning this poll thing, so that's what we'll do next time. I can share the results, and then it will do that, okay? Yeah, so these were the results here. And this don't tell you the right answer, it just tells you what most people did, okay? Just because everybody did it don't mean it's right. So that don't look back at this and say, oh, that was the right one. Excuse me, just because it's orange. Okay, that just happens to be the one that everybody chose. Okay. All right. Let me stop the poll, that poll. Let's see. All right. Okay. All right. So we got a few little polls we can do as we go on. That'll help make sure we get where we're supposed to be. Anybody had any questions about, oh, I thought it was this, or I could have swore it was that. That way we can fix that situation. Okay. All right. Were there any questions on that poll? All right. Now, this is what I want you to do now. I want you to have just a scrap piece of paper, and you don't have to put it in the chat, but I'm going to put up some waveforms, and I want you guys to be able to tell me which one they are. So number 1 is going to have a waveform. You just write down on your paper. Number 1 is this. Number 2 is that. All right. And then as we get done, we'll go over them, and I'll call somebody and say, okay, what did you get for number 1? What do you think number 2 is? It's okay to get it wrong now. This is the time to get it wrong, so don't be shy about it. All right. All right, so I'm going to put those up. Once we get done with that, we're going to take our break. Let me share my screen. I'm going to make it bigger. All right. Interpretation quiz. Tell me what you think that. Just write it down, and I'm going to move on. I'm not going to stay on it forever. Look at it. I'll give you a minute or so to tell me what you think it is on that problem. Then I'm going to scoot on over to the next one. Okay? All right. All right, I'm moving on up to the next one. Number 2. All right, let's look at number 3. Number 3. All right, let's look at number 4. All right, number 5. Let's look at the number 6. What is number 6? All right, that one should have been easy. What number 7? And when you're working on these, I want you to make sure you assume you can assume that all of these are 6-second strips. These are all 6-second strips, just FYI. All right, what about number 8? All right, and I think that was it. All right, so let's look at them all. Number 1, Talicia, what you get for number 1? Unmute your mic, I can't hear you.
I'm not really sure.
Okay.
I'm not really sure. I'm not really confident in my answer. So can we do somebody else?
Okay. Sydney, what you get for number 1?
I'm not sure if it's right, but I put ventricular fibrillation.
V-Fib. V-Fib. So number 1.
Was that correct?
I'm pulling it up now. V-Fib, number 1. Good. All right. Number 2. Number 2, let's see here. Lori, what you get for number 2? No. Ventricular tachycardia? No, that's not ventricular tachycardia. Christian, what about you for number 2?
I'm not sure, Mr. McCarthy.
Okay. Michaelin, what you get for number 2?
I got Vtac.
Vtac for number 2?
Yeah. Yeah,
about
but
this
you said that was wrong.
This one right here.
Oh, that one?
Yeah, this is number 2.
Okay. I'm not sure. Maybe PVC?
Oh. Yep, see, these answers are, you got the strip and you have the answer. So this is number 1. This one's number 2. Okay. This one is number 3.
Atrial flutter.
Atrial flutter, good. Good. Atrial flutter. And that's what I said. Sometimes they say something different, but that if you get that one, that's what I want you to say. That's A flutter. There it is. Boom. Atrial flutter for number 2. Okay, so this one is number 2. Everybody make sure you follow me. This strip right here is number 2. Now, number 3 is this strip. This strip right here is number 3. Heather, what you get for number 3? With this strip right here. What's this called?
Okay, and with that one.
What'd you say, Heather? I didn't hear you. Are you with us, Heather? Because if y'all with us, turn your camera on so I can see who's with me, and I won't have to keep asking, calling on names that are not there.
Can I try again?
Who's that?
Felicia.
Yeah, go ahead. Go ahead.
Is that one PVC?
This one right here?
Uh-huh.
No, not PVC.
Vtac.
V-Tac. Good. Who said that?
Kelsey.
Okay, Kelsey. Okay. Yeah, this is V-Tac, ventricular tachycardia. That's the one that's deadly. That's one of the deadly ones there. That's one of your deadly ones. All right. Let's see. Yasmin, are you with us? All right. Okay, Yasmin, I see your video. So what you get for number 4? This one right here, Yasmin. What is this?
I'm not sure.
Well, this one you have the PQRST, PQRST, PQRST. Then you have another QRS that came out of nowhere. What is that called?
Can I answer?
Yeah, go ahead.
PVC.
PVC. That's a PVC, premature ventricular contraction, right? You have a QRS, which is the ventricular squeeze or depolarization, right? When it comes out of place, it's premature. It's premature ventricular contraction, which is a PVC, all right? It should come after the P wave, right? You got a P wave, QRST, P wave, QRST. Now, if you have a T, and then you have another QRS right here. Bam, he came out of nowhere. He came before the P wave, right? That's out of place. That's a PVC. Y'all make sure y'all study this stuff. Not gonna get any easier. Number 5. This one right here is number 5. Let's see who's out here. Kelsey. Oh, wait. Michaelin, tell me what you get for number 5. This one right here. You see, everybody see you got QRSs, but the P waves are kind of just quivering. So what is that, Michaelin?
Sinus arrhythmia.
Oh, when you have your QRSs here. Now it is an arrhythmia, but this is not what I'm looking for. You have your QRSs, guys, but the P wave, look at the P waves, they're just kind of quivering. Michaelin, so what if the P wave is just quivering, then what does that mean?
Pre-waves. It means it's fibrillation. So
Atrial fibrillation.
fibrillation.
AFib. That's AFib. The atria are just quivering, right? The atria, they're not really contracting, so they're just kind of quivering. So all these, you just sound like the P waves are just kind of quivering through there. But you have your contraction, you got your QRS there, but the P waves are just kind of twitching. That's called AFib. Atrial fibrillation, which is not deadly. All right. Number 6. Let's see. What's your last name? Grant. Tara. What's number 6? This one right here. PEA, no. Asystole. Asystole is flatline. There's no contraction. If it was PEA, that would be a perfect waveform there, but it wouldn't have a pulse. Okay, so you can't really see PVA on here. I couldn't show you a PEA on here and say what is it without telling you that the patient does not have a pulse, right? If I have a regular normal sinus rhythm, but in the question it says this patient does not have a pulse, then you would know that that's PEA or EMD, okay? All right, so that is asystole. Number 6 is asystole, flatline. Flatline. What about number 7? Anybody tell me number 7? What you think for number 7? Probably sinus tachycardia. Normal sinus rhythm would be 60 to 100 beats per minute, right? That looks a little fast, right? And I said that they were 6-second strips, so that will be super fast. Really, in all, that would be super ventricular tachycardia, but let me see what they said. They probably just, number 7, sinus tachycardia. Number 7 is sinus tachycardia. That was this one right here. Sinus tachycardia. So it got all of its parts and it looks good, right? The R's are perfectly spaced, but it's just fast. It's just too fast. So it's sinus tachycardia. All right, well, what about this one? Sydney, what you get for number 8? This one right here.
I wasn't sure. I just looked at the graphs in the book and I thought it matched up to the first degree heart block, but I don't know if we even went over that.
Yeah, we did, but don't worry about the heart block. None of these are blocks.
Okay. So I'm not sure because that's what I put. So
Can I answer?
Yeah, go ahead.
Sinus bradycardia.
Sinus bradycardia. It's got all its parts. It's just super slow, right? 1, 2, 3, 4 R waves. So that means the heart rate is what? What is it though? If it's
40.
40. Remember, you count the R waves and multiply by 10 if it's a 6-second strip. All right? If it's a 6-second strip. Okay? If not, if you don't know that it's a 6-second strip, you have to count the large boxes. So in between these two right here, we have, let's see, 1, 2, 3, 4, 5, 6, 7. It's about 8. 8 large boxes in between these R waves. So 300 divided by 8 is what?
37 and a half.
See that? So it's about 40. Heart rate is about 40. So 37 really in this one. So that's sinus bradycardia. Anything less than 100, anything less than 60 is bradycardia. Anything greater than 100 is tachycardia. All right. All right. So that's good. Little stumbling on these. You got to learn these. You got to know the basics. You need to know sinus brady. You need to know sinus tachycardia. Everybody should know asystole, right? This is aphil. You have QRSs, but the P waves are just twitching. See that? That's AFib. This one here is looking good, but then bam, all of a sudden you have a wide, bizarre looking QRS. That's a PVC. Okay, this is PVCs. All right, this is sinus tachycardia, another deadly one. Sinus tac. No, I'm sorry. Not sinus tac, guys. Vtac. Not sinus tac. This is Vtac, ventricular tachycardia. Fire. The ventricles are just popping off. No time to repolarize, nothing, right? They're just popping off. That's Vtac, ventricular tachycardia, which is deadly. This one is, it looks like V-Fib, but it has the QRSs, right? So you know this is that sawtooth pattern. This is atrial flutter, flutter the cutter. Remember that? The cutter kind of looks like a blade, a knife edge. All right, flutter the cutter. So this is a flutter. You have your QRSs, so your ventricles are doing fine. It's the P waves. Those P waves are just sharp, popping off P waves. That is flutter, atrial flutter. Okay, look at the difference between atrial flutter, this, and atrial fibrillation, this. See that? This is atrial fibrillation. They're just quivering. And then up here it's atrial flutter, where the P waves are firing, sharp and pointing. Okay, that's the difference between the two. And of course, the first one, which is also deadly, this is ventricular fibrillation. The ventricles are just quivering, not really going a good QRS, it's just kind of quivering. This is V-Fib, and V-Fib you must defib. Okay, you got to shock them. All right, let's take a break. I'm gonna pause the recording. You need to go over these tonight. Make sure you go over these and understand these waveforms, because there will be some on the test. All right. You need to know these. So we're a little slacked on that. Did pretty good with the poll. We're going to take a break, and then we're going to come back. Here are some of those, what I was telling you about. These are oral questions. These are the questions that come from your oral exam. Right? I don't think I showed it to you once before. But every section, RT210A, B, C, D, everybody has a group of them. And they're all mixed up into just big stacks of them, okay? We got large stacks of them. You don't know which one it is. It's not color-coded at all. They're not size coded, nothing. They're all mixed around. The student will pick 20 of these cards face down. You'll pick 20, and the instructor will pick it up and read it to you, and you have to answer the question. So we come back from break, I'm going to ask some oral questions to everybody in here. All right, you won't have time to look up nothing. It's just see what you got on top of your head. When you take the oral exam, you won't have any paper, you won't have any notes, nothing like that. Okay, you need to be fully dressed out, stethoscope and everything when we do the oral exam. So I'm going to cover RT210A and RT210B questions. All right, and that's what we're going to go over. I got about maybe 10 or 12 of them. I'm still going through my stack to pull out cardiac AMP and measurements and terminology. Okay, so I'm gonna stop the recording now, take a break for 15 minutes. So let's see. Come back at 25 after. Come back at 2:25, and we will start with this oral practice, getting some practice over the stuff we've learned, and we will end the day with the cardiovascular diseases. Okay? All right. All right, guys, break is over. We're gonna go and get started. I need you guys to put your cameras on so I can see who's here. I've got my oral exam cards right here, and I'm gonna shuffle them up, and I'm just gonna go down the list of people that's on the Zoom and ask questions. All right, I know Yasmin's at work, but I'm not gonna be recording this, guys. So you need to be a part of it now, because I don't record the calling out of the oral exam questions, because these questions are exact questions. So I can't have that recording and you just go back and study these questions. That's not how it works. So I will be pausing the recording as I go over the oral exam questions. Okay. So I'm going to ask you a question. You tell me what your answer is, and I'm moving on. These questions will go from cardiac AMP and RT210A, which is measurements and terminology. All right. Okay, so Lawrence and Tyra are here. If you're not able to answer any questions, then I need to put you in the waiting room, because I'll be going, I don't know who's here and who's not, and then I have to say, oh yeah, she's not able to answer. Then that's taking too much time. I got a lot of questions, and I can't be asking questions to students who's not even able to answer. I know you might be listening, but you can't answer, you can't participate. All right. The class is from 1 to 6, Monday through Friday. That's what you got to be tuned into. All right, so I will stop the recording now. I'm getting ready to start. Christian Winston, are you here?
You can go ahead, Mr. McCarthy. I'm listening.
Are you able to answer questions when I call you?
Yes, you can go ahead.
Okay, all right. And Heather. Okay. All right, so I'm going to go with people that I see. All right, well, Heather, you can apply to come back in when you get back. All right, Tyra, Lori, okay, Yasmin's at work. Christian's here. Let's see. Kelsey, Sydney, Michael. All right. All right, here we go. We're going to start with Kelsey. Just to show you how it looks, I'm going to show you from another unit. This is how it looks. The category is aerosol. For this one, category is aerosol and humidity. We haven't gotten to that yet. I'm just showing you an example. Aerosol and humidity. Ask the question, and then I'm looking for the answer that you give me. Okay? You either got it right or you got it wrong. You go on to the next one. Each student will get 20 questions. Now, not today, but during the during the oral exam, each one will have 20 questions, just like an exam. You got to miss no more than 5 to pass. The oral exam is worth 16% of your grade. It's got a heavy grade. Your regular unit exams, remember we talked about, are only like 5% of your grade. But the oral is 16% and the final is 26%. So these two are very heavy. They can push you over the ledge and pass, or they can put you under. Okay? Just for FYI, cardiac AMP is when students start pulling away from each other. Okay? This is where stronger students, or the ones who have more time to study, start pulling away from the ones who might be either weaker or not able to study. Okay? And sometimes, unfortunately, they could be close friends. All right? A lot of times that happens where some students will slow up trying to pull somebody else up. Okay? You let me pull them up. You need to focus on your grade, because they got too much to do. Don't be ashamed to be smart, or be ashamed to be excelling. Okay? You got to do for you and make it through. The ones who are struggling, come to me. We go to tutoring. We do whatever we need to do to help you get through it. But this is just letting you know, this is where we see students start to pull away, because we're doing cardiac AMP. Next will be pulmonary AMP, and especially when we get to pulmonary mechanics. Okay, it's getting more and more involved, and you got to be able to go back and use what you've learned to this. So somebody who's either a weaker student, which is okay, because respiratory is not for everybody. I'm not going to say that it is. But some other students are strong, but they just don't have time to study. They got too much going on at that time. And they just could not study like they should have, and end up repeating or finding something else to do. Okay? That's just the reality. All right? Now let's look at these questions. I'm going to stop the recording. If you're watching me, you'll pick back up after the oral practice that we do. And we are still in the middle of answering questions. I'm coming back just to make a quick point. Millimeters of mercury, we said that's the measurement of pressure, right? Just like centimeters of water. Millimeters of mercury is usually known the pressure inside the body, like the blood pressure, central venous pressure, stuff like that. And centimeters of water are pressures that we introduce into the body, like CPAP or something like that. Now, millimeters of mercury is also known as torr, T-O-R-R. Okay? Millimeters of mercury is also written as torr. They're the exact same thing. Just like milliliters and cc's are the exact same thing, so are millimeters of mercury and torr, which is T-O-R-R, torr. And so you may have an answer that says, what's the normal blood pressure? It may say 120 over 80 centimeters of water, 120 over 80 torr, right? You're going to say, well, what is torr? So torr is the exact same thing as millimeters of mercury, okay? So we're going back, stopping recording as I continue with the question. We have now completed the practice oral exam for RT 210A and B. Okay, I did not record that because I cannot record these actual test questions. Okay, as we get close to, when we get to C and start working in C before the exam, I'm gonna do A, B, and C questions, right? And float them around. Maybe not all of them, but float them around. And then same thing when we get to D. That's what we're always practicing orals. And then when it's time for the oral exam, you would have heard it so many times and learned it. You shouldn't be as hard to pass it. Okay. We're going to now take a break. It is 3:17. Let's just say it's 3:20. Come back at 3:30. 10-minute break. Come back at 3:30. We're going to finish up with the cardiac diseases. Okay? Cardiac diseases, and that should complete unless anybody has any questions. We've covered everything. After the cardiac diseases, we would have covered everything. We would do that. I think I have another classroom quiz. It shouldn't take no more than about 15, 20 minutes. And then I'll probably stop for the day. Okay? Yeah, you can go get your shot on this break. If you haven't gotten your shot, you can get your shot. I got it, okay. Right at the table right there. Today was open for my, what was it? Omega students. And if you were Alpha, you wanted to come, you could have come because not that many people are coming. Tomorrow is everybody. Tomorrow is the lab and exam. So make sure you have gone over your laboratory reading or whatever, those questions in the lab book, so you'll know what to expect. We have blood pressure, pulse rate. We're going to be testing each other's pulse, getting blood pressure, and EKG, putting the stickers on the mannequin, right? You got to know. I'm listening for V1 is fourth intercostal space to the left of the sternum. V2 is fourth intercostal space to the right of the sternum. Then we skip to 4. V4 is fifth intercostal space mid-axillary, right? And then V6 is sixth intercostal space. V4 is fifth intercostal space mid-clavicular, the clavicle, right? I need to hear that. And then you're going to say V6 is sixth intercostal space mid-axillary, which is down the middle of the armpit, mid-axillary. V3 goes in between V2 and 4, and V5 goes in between 4 and 6. It makes that curve, okay? That's what I'm looking for, to be able to tell me and to put it on the mannequin. Intercostal is in between the ribs, right? In between the ribs. All right? Intercostal is in between the ribs. So these are the ribs. In between the ribs are the intercostal muscles or space, okay? When you count, you're starting from the clavicle. This is 1, 2, 3, 4th intercostal space. So V1 is the lead, the sticker. V1 goes 4th intercostal space to the left of the sternum. This is the sternum, right? So 4th intercostal space to the left of the sternum. V2, 4th intercostal space to the right of the sternum, right? That's in the book. That's in your reading, either in the lab book and the Egan's book. So you need to make sure you're looking at that, because that's where you're going to place, and I need to hear you saying that when you're doing it. Okay, it's not just putting some stickers on somebody. No, we're not. This EKG. We're doing EKG. Yeah, we're just doing EKG, not the blood flow through the heart. We're doing EKG. That's part of the lab. You're going to have a mannequin. You're going to have some leads, and you're going to have lead wires, an EKG machine. You're going to put those stickers on where they go, and then you're going to put the lead wires clip on to the actual leads. Now, the wires are labeled V1, V2, V3, and you can't mess that up. All right. The trick is knowing where to put the leads, those little sticky leads. And sometimes you have to feel, when you feel on your patient, you feel his clavicle, then that space there is 1, 2, and you just kind of guess 3 and 4, about right there, a little bit above the nipple line is the 4th intercostal space. All right, so you'll V1 4th intercostal space to the left of the sternum. V2 is 4th intercostal space to the right of the sternum. And then we do V4. V4 is the 5th intercostal space. It goes down a little bit. Mid-clavicular, in the middle of the clavicle. So if that's the clavicle, you go to the middle of the clavicle and go down to the 5th intercostal space. And then V3 goes in between 2 and 4. Just kind of fits right there in the middle. Now, of course, I will go over it once in the lab, and then you're going to do it. Okay? We got a lot to do tomorrow because you got shots. People that come in, you come in the group, be on time, because we're going to knock out the test. And when you get done with your test, you can go get the shot. All right? And now everybody gets the shot, we'll go over and do the lab. Okay? Test shouldn't take no more than 30 minutes for you to start. So you need to be on time so we can knock the test out. Everybody can be done, and we can go on. I'm only going to hold the test open for an hour. 1 to 2, that's it on the test, okay? So if you're late, you're going to, wherever you end up, that's what you got, okay? Make sure you are here and on time. So I'm going to take this break. Like, we're on break now. I'm just kind of talking. But we're going to start back at 3:30 talking about the cardiovascular diseases. And that should do it, okay? That should pretty much do it. All right. Let me pause the recording. All right, guys, we're back. And we are about to show you some of the EKG. I'm going to go over some of these EKG placements right quick so you can kind of see it. To also help you prepare for tomorrow. Now, since this is, I am going to record this video, but I can only record it through the overhead. If I put it in my video and try to record it, it's going to flag me for infringement, okay? And it's going to cut my whole video for today off. So what I'm going to do is just let you hear it and see it from the background, and then YouTube won't be able to catch that, all right? So I'm going to show you on the mannequin, show you quickly, let him kind of explain some of those spaces and why we do that. Not the whole video, just a few minutes of it. And then we're going to put some stickers on him, knock out a few of those cardiovascular diseases, and we'll be done, okay? Because like I say, it's 1 to 6, and a lot of times you're going to get out before 6, but cardiac anatomy, some of the ones that are like pharmacology, those are ones I go hard. It's just a lot of information. All right, if you miss Friday and miss today, just imagine how far you will be behind, okay? Almost too hard to catch up. All right, for those of you that are at work and trying to listen, I appreciate it. Like I said, I don't trip out. You know, I understand people have life. I had a wife and 4 kids when I was in school, okay? And I got 8 kids now. So I know how it was because I had to do the bulk of the work, come home, get stuff together. It was a lot of stuff, a lot of issues, right? I had a lot of issues. I had to get school clothes ready, all that stuff. Some of the stuff she didn't do, and just we had issues, so I'm not with her anymore. But that was years ago, okay? Now I have a wife who helps and is doing her part. I'm doing my part like we're supposed to, and I hope you have that, but everybody doesn't, okay? But I know how the single part was at first, so there's no excuses to this, all right? This is your education. You got to make it work. Anybody seen the movie Friday? When she said, go get me some cigarettes and gave him $1. He said, this ain't gonna work. What she say? Make it work. Make it enough, okay? So you got to make it enough, all right? You got to secure your bag. You can't worry about nobody else, all right? So let's look at it. This is the mannequin, Mr. Johnson. Show you a little bit of what I can, right? This is his left. This is his right. Okay, let's not forget that. You're always looking at the patient's left and the patient's right, not your left and right. I'm gonna put this on here. This is his left. Right. All right. Probably about a $40,000 thing. I hope it come on. Not permanent. So this is your patient's left. This is your patient's right. Every time you look at it, it's not your left and right. So don't mess that up. Okay. These are the leads right here. Little stickies called leads. All right. Now, we said that you're going to look at the video. He's going to kind of show you the lead placements, and then we're going to come back to him and feel. You see these divots? These are the intercostal spaces, right? Right. And we're going to show how we're going to go left, right, and then go around to the side. Okay. This is for proper EKG lead placement. Okay. I'm gonna cut the light off and I'm gonna scoot this up as much as I can and let you watch this quick information because it's very informational. He goes a little farther than we need him to go, but that's all right. Then we'll get back to Mr. Johnson and put him on him and then finish up with the actual diseases. Okay. All right. Share my screen. Now, I don't have my speakers hooked up to it, so you're going to have to listen close. I'm going to turn the computer speaker up as loud as it'll go. All right. Why is my screen not sharing? Share this screen. What do y'all see on the screen right now? My desktop? Yeah, what? Why come it's not showing the screen? All right, well, oh, you know what? You see it now, don't you? I mean, you see the board, right? Yeah. Okay, that's what I'm supposed to do. I mean, you see this, yeah. Okay, there you go. I don't know what I'll be tripping on. And it was already sharing. All right, here we go. Don't play. volume all the way up. All right, here we go. Listen closely. Let me put this fan on.
Stickers or electrodes that we're placing on our patients when we do a 12-lead ECG. In my previous video, I talked about before limb leads. They should always be placed on the extremities. For a 12-lead ECG without permission monitoring, that's just a 3-lead ECG. It can sometimes be appropriate to just put the leads directly on the patient's torso and these patients. The skin here, and we want to avoid putting electrodes on any bony tissues. We also want to avoid larger muscle groups. The ideal location is left arm, and then we want to do the same kind of thing, mid-clavicular line, just below the costal margin for our right lower and contralateral that we have left lower. If I remove the skin here, you can see that's just below the costal cartilage there. As for the chest leads, we have V1, we have V2, V3, V4, V5, and V6. Unfortunately,
Now look, just quick information. This one right here says right leg, left leg. That's what he's talking about. Right leg and left leg. This is only because sometimes paramedics don't have, he's talking to paramedics, and they don't have the time to take your pants all the way off and all that to put it on your wrists and your ankles. The left leg and the right leg lead should be on your ankles, left and right ankle. And on the left arm and right arm should be at your wrist. Left wrist, right wrist, and then on your ankles, left ankle, right ankle, for your extremity lead. That's called your extremities, right? Okay. You'll have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It's 12 lead EKG, but it's only 10 actual leads on you. Okay. But the left arm and right arm, you guys will put on right here and right here because our mannequins don't have legs or arms. Okay. But just know in the field, you want to go down as far as you can. Pull their pants leg up a little bit, put one down there, and pull their sleeves up and put it on their ankles, okay, and their wrist, all right? But for our purposes, we are going to use the lower part right here. Sometimes you can even put it on their hip if you pull the pants down just a little bit because people are shy and they don't want you pulling their pants down and all that kind of stuff. You just need a quick shot. You can do it right here for the arms and legs, okay? That's all he's doing, so let me keep going. So notice, V1, V2, V3, where's my stick? V1, V2, V4, V6, and we go back, put V3 in between 2 and 4. We put V5 in between 4 and 6, okay? And that's your curve. Now, he's going to talk about, he's going to go deeper inside this man and show you his sternum, his clavicle, and his intercostal ribs, all right, spaces in their muscles as they pertain to where these leads go.
the patients that we have are not transparent, so we actually have to copy them. So here we have it.
Is he talking? Because I can't hear him.
Let me make sure I didn't lose my
Yeah, the video just moving with no sound.
yeah, I know. Hold on one second. Wow. It just messed up and dropped.
Landmark is because just lateral, you have the second rib.
I'm gonna rewind it a little bit. It kind of went off a little bit. I dropped the speaker in it.
This little line right here, the upper part of the sternum is of course the manubrium, and the body of the sternum is below that. So this angle right between the two of them, this line right here, it's called the angle of Louis.
You're gonna learn that later.
The angle of Louis, but it's actually a French name, so it's the angle of Louis. It's a little bump. We can palpate this on our patients, so it's easy to palpate the notch right up here, and that is of course the suprasternal notch or interclavicular notch. We can actually visualize this notch. You want to move a few inches down to the point where you
Don't
feel
worry about all
the bump,
that.
and this is the angle of Louis right in this location here. The reason that this is such a valuable landmark is because just lateral you have the second rib, your starting point. And then below that you have your second intercostal space. Then you have your third rib, third intercostal space, and your fourth rib. And just below the fourth rib.
There we go. This is your fourth intercostal space right here. Okay, fourth intercostal space. So this is the left. So V1 is fourth intercostal space to the right of the, V1, okay? Fourth intercostal space to the right of the sternum, okay? V2 is fourth intercostal space to the left of the sternum. Okay, I might have said that backwards earlier, but it's going to go across the body like this. The electrical current goes across the body, right? It's going to start on the patient's right and go from right to left, okay? It's going to start from his right and go from right to left from that curve right there, all right? So V1, fourth intercostal space to the right of the sternum. V2, fourth intercostal space to the left of the sternum. All right. Some of the other stuff he's saying, you don't have to worry about it. It's way more detailed than we need to.
Locating the angle of Louis, which again is right here. You can also start off by locating the clavicles because that's a really easy landmark. The clavicles lie just superior to the first rib. You can always move bases. The next lead we apply is actually V4. The reason why we don't apply V3 is because V3 doesn't have a specific landmark.
Okay, so we did 1 and 2. V1, fourth intercostal space to the right of the sternum. V2, fourth intercostal space to the left of the sternum. Now he's getting ready to talk about V4. This will be number 4 here. We don't say V3 right off because V3 does not have a space. You just put it in between. See how it is in between these two? That's all you got to do is stick it nicely in between. All right, so let's talk about V4.
So naturally, we need to place V2 and V4 before we place V3. Okay, so V4 is going to go in the mid-clavicular line.
Mid-clavicular.
So what's the mid-clavicular line? Well, here's the clavicle about halfway through that mid-clavicular line. So looking at my patient's skin, if I draw the mid-clavicular line right in the middle of the clavicle, it's going to go right down here where I placed V4 in the fifth intercostal space. So then you can go ahead and you don't actually need to palpate the location of V3 because, like I said, it goes halfway between V2 and V4. The other two leads, V5 and V6, they are not. They are placed at the exact same horizontal level as V4 was. So in this case, that actually ends up putting V5 on the 6th rib and V6 just below the 7th rib.
All right. So since we're having a little technical issues with this, I'm going to go ahead with the mannequin. That's all I needed you to see, though, basically, guys, is the V1, V2, and how we do V4 is fifth intercostal space, mid-clavicular. Mid-clavicular. Then V6 is sixth intercostal space, mid-axillary. Okay, mid-axillary. And then you just put 3 and 5 in between where they go. Okay. Of course, your left arm will go up here. Christian's trying to get in. Left arm will be up here somewhere. If they have arms, you put it on their wrist. Right arm up on the shoulder, unless he has arms, you put it on his wrist. And then left leg and right leg. I mean, it's real simple, guys. Okay. But you got to be able to tell me that when we're doing it. Okay, when you're doing the mannequin, you're going to have to be able to tell me that. So let's look at the mannequin. Yeah, I'm about to do it now with the mannequin. All right. I hope I didn't mess up the speakers. They're going to have to buy me some more. All right, yeah, it says 2001. Can you turn the light on for me, sweetie? Right there. All right, so let's look at Mr. Johnson. Right there, yeah. Mm-hmm. All right. Let's look at Mr. Johnson. This is Ekg Lead Placement, where you place these little stickers. These are called leads. These are the leads. They look like this. They could be round, just depending on what brand you have, okay? But these are called leads. All right, so we said V1, and I might have said it backwards earlier, but listen to me now. V1 is fourth intercostal space to the right of the sternum. So fourth intercostal space, you can't really feel it on him, but his clavicle's up here. So 1, 2, 3, 4. See how I can push in right there and push in right there? Those will be intercostal spaces. So about, about right here, just a little bit above the nipple line. See, this is the nipple line here. You want to go just above it, just a little bit, right? So about right in here. So this will be the first one. All right. V1, fourth intercostal space to the right of the sternum. So that's the sternum right in the middle. All right. V2, fourth intercostal space to the what? Left of the sternum. Okay. Huh? In the intercostal space. Intercostal is in between the ribs. Yeah. But you might not be able to feel that on everybody. You can't be digging in people's chests. So you just have to kind of guess where it is. All right. Then you're going to do V4. V4 is the fifth intercostal space. So if that's one, the next one is under here. Fifth intercostal space, mid-clavicular. Okay. So this is his clavicle. You know, your clavicle is this bone right here, right? The clavicle, you're going to go halfway through the clavicle. So if this is his clavicle here, we're going to go about halfway and shoot down. Okay? That right there. So this is V4. Fifth intercostal space, mid-clavicular. Okay? This is the fifth intercostal space. You can see it even better right here. This will be 4 up here. Fifth intercostal space, sixth intercostal space. See that? Fifth, sixth. Okay. So now we did V4. Now let's do V6. V6 is sixth intercostal space, mid-axillary. Axillary is your armpit. You know how to get sometimes they get a temperature on a patient and say this was either oral or axillary or rectal, right? When we get a temp, we stick that thermometer under their arm. That's axillary. Okay, this is the armpit right here. So this is the armpit. This will be axillary. Mid-axillary is the direct line going down his armpit. Okay, so it would be sixth intercostal space, which is right here, and it kind of see how it curves back up a little bit. So it's going to be sixth intercostal space about right in here. All right, V1, V2. V4, V6. V1, fourth intercostal space to the right of the sternum. V2, fourth intercostal space to the left of the sternum. V4, fifth intercostal space, mid-axillary. Mid-clavicular. Mid-clavicular, okay? Clavicle goes all the way across like that, about middle ways through. Boom, right there. V6 is sixth intercostal space, mid-axillary. See that? Mid-axillary. Then you just fill it in. V3 V3 is in between 2 and 4. So if this is 2 and this is 4, then V3 goes in between. No specific way, just right nicely in between 2 and 4. And then V5 goes in between 4 and 6. About right there. See how it does that? V1, fourth intercostal space to the right of the sternum. V2, fourth intercostal space to the left of the sternum. V4, fifth intercostal space, mid-clavicular. V6, sixth intercostal space, mid-axillary. V3 goes in between 2 and 4, which is right here. And V5 goes in between V4 and V6, right there. Makes a nice little curve, okay? Now, we're not done. We still got the limb leads, the limbs, right? Arms and legs. If you have a patient whose arms and legs are exposed, you want to put it on their wrist, okay? Either the front or the back, don't matter, but you want to have it like on their wrist. But for our purposes, you're going to do this. This will be his left lead, left arm, right? Left arm. And over here, of course, is the what? Right arm. All right. And then you have, I want to say about down here, left leg, and right here would be what? Right leg. That is proper placement of a 12 lead EKG. Don't matter where, you know, you can go down a little further. It doesn't matter. It depends on how comfortable you are, the patient. For men, when you are using it on a female, avoid the breast tissue, okay? If you have breast hanging here, you kind of just, all I would do is use my underside, top side of my arm, my hand, and lift the breast and stick it on there. I wouldn't stick it on the breast, you stick it under the breast, okay? Question. Ankles. Yeah, you want to do the ankles and the wrist. Okay, ankles or the wrist. But for your purpose in the lab, you want to use the shoulders and the hips. Okay. And it's on, I'm looking at it backwards, so it's, not perfect, but that's, make it good as you can. This is a placement of a 12 lead EKG. Then, of course, you'll see tomorrow, you have lead wires, and each wire has a little clip, and you will stick them on the prospective one. The wire is going to say V1, and it's going to be color-coded. Next one's going to say V2. You just put it where it goes, okay? There's no special way to do it. You look at whatever one you got in your hand, you put it there. If you got left leg lead in your hand, lead wire in your hand, you put it on his left leg, okay? You just follow it, and that's it. Once you get the patient all hooked up, they must be very quiet and still. Anytime they're moving around, it's going to show up on your EKG. So you just say, Mr. Johnson, just be quiet. Well, no, be still for just a minute. Let me take a picture of your heart. We'll be done in a minute. Here later, real still, you will see your EKGs coming across the screen. There's a button you push called capture, and it's going to print it. It's going to capture 10 seconds of data. So it's going to wait till he's good and still and capture 10 seconds of data, and then it's going to be complete. You push print, tear it off, hand it to the physician. You don't have to read it. You don't have to say, oh, this is ventricular tachycardia. You don't have to say this is normal sinus rhythm. Patients will ask you because respiratory does do EKGs, okay? Especially late at night. If the EKG techs are gone, if they need an EKG and an ED, that's who calling is respiratory. Respiratory does do EKGs around the hospital. So you must know how to do this, okay? Otherwise, we wouldn't be even going through this, okay? But this is how you do the EKG. Courtney, V1 goes where? Where is this at?
It's the fourth intercostal space to the right of the sternum.
Excellent. Talicia, where's V2 at?
It's the second intercostal space to the
V2 is same spaces.
V2. I'm sorry, I can't say it out loud. I don't know.
You gotta get over that, Talicia. Fourth intercostal space. Say fourth intercostal space.
Fourth intercostal space.
To the left of the sternum.
To the left of the sternum.
That's it. Michaelin, what about V4?
was fucking hard.
Fifth intercostal space left to the mid-calvary?
No.
Calver?
Fifth intercostal space, mid-clavicular.
Mid-clavicular.
Yeah,
Okay.
that's the clavicle, your clavicle bone. So you're going halfway through the clavicle bone. Okay. This is my clavicle. This is his clavicle, here and here. This is Mr. Johnson's clavicle. This is his left clavicle and his right clavicle. And so for V4, yeah, V4, it is 1, 2, 3, 4, 5, fifth intercostal space, mid-clavicular. So you find the middle of the clavicle, about right in here, and then go 1, 2, 3, so 1, 2, 3, 4, 5. So about right in here. See where this is already at? Somebody already got one there. See that? Fifth intercostal space, 1, 2, 3, 4. Fifth intercostal space, mid-clavicular. That's the middle of the clavicle. Okay? That's V4. And then, let's see here. Yeah, Kelsey, what about V6?
Fifth intercostal space.
Say it again, I didn't hear you.
Fifth intercostal
Not
space.
fifth,
Mid axillary.
not fifth, but sixth.
Sixth.
Sixth intercostal space, mid-clavicular.
Axillary.
I mean, shit. Mid-axillary, I get them mixed up all the time. Mid-clavicular, this is the clavicle up here. Axillary is the underarm. So V6 is sixth intercostal space, mid-axillary. All right? Mid-axillary. Now, Shatara, what does V3 go? Good. V3 goes in between 2 and 4. Just put it in between. And Brittany, where does V5 go? In between 4 and 6, right? Then you have, of course, his left arm, right arm, and then his left leg and right leg. That's it. So look at this video tonight so you're prepared for it. You'll be able to tell me it. So everybody's going to have the mannequin and put the stickers on. I'm going to give you a blank set and say, okay, go. You're going to say V1, boom, V2 goes here, V4, V6, V3, and V5. Okay? Left, right, arms, and legs. And you're done. Hook them up with the lot. You don't have to print it off and all. They're going to hook up the wires, and that's it. That's all I expect. That's one part of the lab tomorrow. Yes. No, the only part of the lab is this, blood pressure, and pulse. To read each other's pulse, take each other's blood pressure, and EKG. And you don't have to mention the heart. The heart's, that's just part of the test. The lab is what you got to go and do. Show me how to hook up an EKG. Show me how you would take a manual blood pressure. I showed y'all that in the video when I showed you the sphygmomanometer and the stethoscope, how to do it. That's in your lab book as well. Make sure you read over that so you can see how it's done. And then taking each other's pulse. When you feel, palpate a pulse, what did I tell you not to use? What part of your hand do you not use? The thumb. You don't use your thumb. You put your 2 fingers over their radial pulse and you count how many times you feel it beat in 1 minute. So that's why you should have a watch in your lab that's fully dressed out. Respiratory should have a watch, stethoscope, lab coat, all those things when you come to lab. And so that way you can be putting your fingers on there, palpating, and looking at your watch. Okay, you're looking at your watch and just counting the beats. Now, don't watch it and count at the same time. Best thing to do is when your hand gets to a certain number, then look away from the watch and just start counting what you feel. And then glance back at your watch every now and then, because when it gets back to that same number again, that's a minute. Okay, however many times you felt it. If you felt Mr. Johnson's heart, his pulse, 80 times in that 1 minute, then his heart rate is 80. If you felt it 60 times in that 1 minute, his heart rate is 60. If you felt it 120 times, it's 120. Okay? Somebody had a question?
Mr. McCarthy?
Yes,
Yeah,
ma'am.
are we going to have an oral test tomorrow also?
No. Oral is at the end of the program.
Okay, just making
In the
sure.
RT210. That's just, I'm doing that for your practice to get you ready for the oral at the end.
Okay, I was just making
Count it
sure.
for 30 seconds and then times it by 2.
That's one way you can do it, but NBRC wants you to count it for a whole minute. You can do how you want to when you get out in the field, but for the lab, you must count it for the whole minute. Okay? Yeah, there's a lot of little quick tricks and ways to do it, but that's, you can even do it for 15 seconds and do it 5x4. But, you know, NBRC hospital is the hospital that you guys work at until you graduate, okay? And they want it by the book. The full minute. You just count it for the full minute. Now, you're going to also do the patient's respiratory rate. It's the same thing. You just counting the in and out. That's 1. That's 2. 3, right? You don't tell your patient, I'm counting your breaths, because then they're going to start breathing and all kind of stuff, right? You're just doing it while you're doing other things. You have to learn how to you can be doing the pulse and respiratory rate if you want to, right? Once you get used to it. But yeah, you just count in and out, that's 1 breath. In and out, that's 2 breaths. However many you saw in a minute, that's their respiratory rate. Who can tell me the normal respiratory rate? I don't think we said it yet, but you need to know what it is. Normal respiratory rate is 12 to 20. 12 to 20 breaths per minute is the normal respiratory rate. Make sure you write that down. Normal respiratory rate is 12 to 20 breaths per minute. What's going on here? Normal respiratory rate, 12 to 20 beats per minute. I have to get me some more speakers. I believe it's all done. All right, so let's go ahead and knock out the last little part. Somebody say something on here so I can see if I can hear you.
I have a question.
Are you talking?
Yeah.
Somebody talk so I can hear you.
I'm talking. Can you hear?
Okay, talk again.
I don't think you can hear.
Question.
Yeah. So the speaker is not working. My computer speaker is working, but this speaker, when it dropped, it stopped working. So I'll get another one. No big deal. All right. So get your notes out so we can finish our notes and get that out the way. All right. Cardiac AMP. Lesson plan. And it's only like a page level. We don't have much left on that. All right, here we go. Let me share my screen. All right, can you see it? Cardiovascular diseases. All right, here we go. Cardiovascular diseases. Let me make sure you got these last little bit of notes up here before that. Yeah, we were talking about the EMD and V-Fib and all of that. Yeah. Okay. So I'm just going to go through it. I'm not going to talk about it. I'm just going to do this right quick so you can go back if you not sure. When you watch the recording, you can go back and pause it and write whatever you're missing. Okay, so this is the atrial rhythms, and then we got down to the ventricular rhythms. All right. All right. Now, Let's look at the cardiovascular diseases. Yasmin, what notes are you talking about? These notes here, or are you talking about the beginning of the program? Because if you're talking about these notes, they're in the live lectures. It'd be best for you. I can't email you the lesson plan.
Yeah, I was talking about these notes. I didn't know if they were taking these as notes or not.
Oh, yeah, we've been taking notes. It's part of your note-taking guide. Your note-taking guide that you have follows along with this right here that I'm taking, or the PowerPoint. But this actual lesson plan, I can't email it to you. That's copywritten. Even though you're looking at it and it's recording, I can't do that. You have to go back and watch the lecture. They have been recorded, so you can watch the lecture and pick up any notes that you missed at the beginning of this lesson, okay?
Okay.
All right, cardiovascular diseases. Hypertension, high blood pressure. That's all it is. High pressure in the cardiovascular system. It's caused by a driving pressure of the heart. If the heart is pressing too hard. Resistance of the vascular system. When there's clotted arteries or anything like that, you build up resistance that causes a higher pressure. What happens if you have a water hose and you put your thumb over it? It comes out faster because the resistance is building up great pressure, and resistance is now inside of the vessel, right? Inside of that water hose, the pressure has jumped up. And that's what same things happening in your arteries. When your arteries have been blocked a little bit, then it's like putting your finger over it, right? You start to squirt out harder. What was that? Star, what you doing? I didn't know y'all could even do all that. All right, erase that. All right. Normal blood pressure, 120/80. That's systolic and diastolic millimeters of mercury. All right, mmHg. The next one is myocardial infarction, also known as an MI or a heart attack. Will they let you erase that, Stop? Because it's still on. MI is a myocardial infarction, and that's a heart attack. As we said before, that's when the coronary artery becomes blocked. Okay, tissue becomes ischemic and then necrotic, and the muscle is weakened. These are some very important terms here: ischemia and necrosis. Right? Those are some terms you need to make sure you understand. What happens is this. This is the coronary artery. These red ones are the coronary arteries. This is how the heart itself gets its blood, right? We said arteries take blood away from the heart to the body, right? Well, these coronary arteries go away from the heart, but back to the heart, okay? It's taking blood to the actual muscle. Our aorta, right, takes blood down to the body and all of the tissues, right? That's taking that good, rich, oxygenated blood to the body, right? Well, what about the heart? The heart it's got to get its nutrients, right? We said the blood is transports the respiratory gases. We said the blood circulates the defenses, right? Brings nutrients to the cells, removes waste from the cell, electrolytes and clotting. Well, the heart got to have that too. The heart is perhaps the most important muscle that you have, right? So how does the heart get its blood, and how does the heart get rid of its old blood? Well, it gets its blood through the coronary artery and gets rid of its blood through the coronary veins. Okay, blue, deoxygenated. After the heart has used up its good old oxygen and nutrients and all that, then the CO2 and waste product is then taken back to the right atrium through the coronary veins, right? They link up with the superior and inferior vena cava and dump into the right atrium to go through the circulation to the lungs, back to the heart to get its blood again, all right? So don't forget about the old little heart. He has to get his own nutrients and blood supply as well. So what happens in an MI or myocardial infarction is this artery becomes ischemic. Ischemia, guys, write this down if you haven't already. Ischemia is lack of blood flow to an area. The
How do you
lack,
spell ischemia?
I'll show it to you in a minute when I go back. It's I-S-C-H-E-M-I, I think. I'm not the speller. The wrong one. But we'll see it in a minute. Do it the best you can. Ischemia is lack of blood flow to an area, okay? If somebody has an ischemic heart attack, it's because the blood was blocked from the heart. It was a lack of flow because of that fried chicken and French fries and all that stuff you've been eating has clogged up one of these coronary arteries, right? When one of these coronary arteries become blocked, it causes ischemia to an area. The blood can't get there anymore. Like a blood clot or anything gets caught up in here. Now, everything behind the clot is dying, right? Because it can't get there. It's got to have blood every second of your life. As soon as the blood stops flowing, the heart starts to feel it. It starts to die. Death of tissue is called necrosis. So necrosis is death of the tissue. It starts to be necrotic. When something's necrotic, it's dead, rotten, stinks, right? If somebody has a necrotic foot, that means it's about dead. It doesn't get any of it, they're going to cut it off, right? Because it's going to start being infection up the rest of your body. And it stinks like a dead body, okay? So it's necrotic. Once it has ischemia, which is lack of blood flow to that area. So let's just take, for instance, let's look right here. Mr. Johnson's coronary artery, let's just say it was blocked right here. It stopped. The blood was coming from the heart and stopped right here. Now it's no longer flowing right here. Now, that rich oxygenated blood is now not getting to this area, right? Because it's blocked right here. So this blockage is called ischemia. There's a lack of blood flow to this area. It becomes ischemia. And as the ischemia persists, this tissue starts to die or experience necrosis. Okay? Once it dies or becomes necrotic, it's going to let you know with pain. It's going to let you know, hey, what you doing? And you're going to know it. Okay? It's going to let you know that it has died. And that is called a heart attack. That's what happens with a heart attack. The blood becomes ischemic. The tissue then becomes necrotic, and it will die and cause a heart attack. All right, that's what happens. So therefore, what you'll see a lot of times in the hospital, they'll go in and bypass this area. So say this area right here is blocked. Well, we'll take some artery vessel tissue from another place in your body and take it from here and go around there to here, right? It's called a bypass surgery. When they have bypass, they're bypassing the clot or the blockage. They just take it and graft another piece of artery to the good flowing part and go around the blockage and then start supplying that blood and nutrients back to that part again, okay? Now, it'll never be the same again. Once it dies or it starts to become necrotic, it becomes weakened. So even if we do a bypass surgery, you'll see that patient can't do the same thing they used to do. They get short of breath. They have little issues because the heart will never be the same. Okay, you may live, but it's not the same. Some people have quadruple bypass, so they might have 4 places that is blocked, and they got to go around and bypass all 4 places, right? Or they might have to put a stent in, right? A stent is when they go inside of the vessel and open it up, and then pull the mesh out, and it's that way blood can flow again. Because the lack of blood flow is called what? Lack of blood flow to an area is what? Ischemia.
Ischemia.
Ischemia. And once there's an ischemia present, everything behind there starts to die, which is called
necrosis.
Necrosis. And that causes the heart attack. Okay? That is what causes the heart attack. So let's look at this right quick, which of course I won't be able to record it, but I do want to show you something right quick. Those are just different things wrong with the mitral valve. Or a heart murmur is just when the valve is too much open or it's going back and forth, blood is going both ways. It can be benign, it can be a problem. It just depends. All right, I'm gonna show you this right quick. I just want to show the animation of the blood flow through the coronary artery and what happens when we go fix it. Let's see. All right, I'm gonna share my screen. I want you to see this right quick. Now let me stop. I can't record this part. Okay, so that was a video of placing a stent or bypass surgery of coronary artery disease. That was on YouTube. You can just type it in and there's plenty of videos you can find the animation. All right, let's keep going with the notes. So myocardial infarction or a heart attack, that coronary artery becomes blocked. Tissue becomes ischemic, right? Has a lack of blood flow. Then becomes necrotic, and then the muscle is weakened. It's going to let you know that you weakened it because it's going to give you some pain. All right? That's myocardial infarction and how it happens. The next one is called cor pulmonale. Cor pulmonale or cor pulmonale, guys, is right-sided heart failure. Right side heart failure is usually because of a pulmonary disease. Right side heart failure usually happens because of some type of pulmonary disease. COPD, ARDS, pulmonary edema, anything like that. Any kind of diseased lungs can cause right-sided heart failure, okay? One reason is because, what is this right here? Anybody? Not the pulmonary vein. No. Pulmonary
artery.
Pulmonary artery. So when the blood returns to the heart via the superior and inferior vena cava, goes into the right atrium, into the right ventricle, into the pulmonary artery, and then to the lungs. Okay. Now, if there is a lung problem and the blood cannot get to the lungs like it should, usually because of high pulmonary artery pressure, right? Hypertension. This is called pulmonary hypertension. Not regular high blood pressure, but high blood pressure of the pulmonary artery, okay? So just think, if this pulmonary artery used to look like this, but now the tension inside the artery has it like this, the blood can't get to the lungs, right? And if it can't get to the lungs, it starts to back up. It's going to back up into the right ventricle, back into the right atria, and back into the superior and inferior vena cava, right? And then you can see it. That major vein in their neck, the jugular vein, that's the superior vena cava. And when they lay back a certain way, it'll start thumping, right? People lay back and it gets real big. That's right-sided heart failure because the pulmonary artery pressure is so high that the blood cannot get to the lungs freely. So it starts to back up, right? If everybody starts going toward the door at the same time, it's going to start backing up because everybody can't get through, right? At the same time. So that's what happens. Right-sided lung problems cause right-sided heart failure, which is called cor pulmonale. All right. You'll notice that when we get to talking about that more, it's called JVD, jugular venous distension. Some patients lay back 30 degrees and it gets big, right? You just see it get big and pulsating. You're like, what's all that? And they have to sit up because of their right-sided heart failure. Okay. And so that's the problem. Now, what do we give for pulmonary hypertension? There's a medicine that we give for pulmonary hypertension, and that is Viagra. Okay, Viagra was originally made for pulmonary hypertension. It was not made for ED. Viagra was originally made, which the generic name is sildenafil. It was originally made for pulmonary hypertension. What happens is you give the Viagra and the pressure inside the pulmonary artery relaxes. It dilates the pulmonary artery. So now blood can freely go to the lungs, because if it can't get to the lungs, it can't get oxygenated. And your sat is always going to be low because blood can't get to the lungs. That's where it picks up the oxygen, right? If it can't get to the lungs to pick it up, then the person's saturations are always low. All right, we have to give them oxygen a whole lot to minimize that problem. Okay, to try to compensate for the lack of blood that's getting to the lungs, which you'll learn a little bit later. But what I'm trying to show you is right-sided heart failure is pulmonary. Right side of the heart is pulmonary, right? Pulmonary circulation. Anything wrong with the lungs can manifest in right-sided heart failure, which is cor pulmonale. Okay? Anything going on the right, cor pulmonale. All right? All right. Cor, right here in your notes. Cor, C-O-R. Cor pulmonale. That's right-sided heart failure. It's usually due to pulmonary disease, some type of pulmonary disease they have. It sometimes causes right-sided hypertrophy. What does hypertrophy mean? That's one of your terms. Hypertrophy. What's that mean? Anybody? Hypertrophy. When the right side of the heart is showing hypertrophy, what does that mean?
Increase in size.
Increase in size, overdeveloped. Hypertrophy means overdeveloped. Overdeveloped, because that side, now look, the right side, if it can't get the blood through the pulmonary artery, it's going to start pushing harder, right? It's going to have the right side, the right ventricle is going to have to work harder to get the blood through the pulmonary artery because the pressure inside the pulmonary artery is so high, right? And if you work a muscle, what happens to a muscle when you work it? It gets bigger, right? It's going to grow. It's going to get bigger. And so then the right side is bigger than it should be because it hasn't to push so hard to get through the pulmonary artery. Okay? It usually could go through, flow through easy. But then when the pulmonary artery pressure increases, now it's harder to get that blood through there. So the right ventricle starts to pump harder and harder and harder. And as it works out, it gets bigger, overdeveloped. That's called hypertrophy. Right-sided hypertrophy is right-sided overdevelopment, getting bigger. If it's not treated, it can lead to left-side heart failure. Hey, I forgot, I was supposed to see you about some kind of cooler.
I gave them all to
Curvo? Okay, thank you. So if the right side is not fixed, you don't fix it, it can lead over to left side of heart failure, right? Because eventually it's going to start backing up into the left side. Then you're going to have other issues, right? So these are the things with cor pulmonale. Number 5, venous distension. That's what I just told you. When that jugular vein starts getting fat, when the patient is sitting up at a 30-degree angle, venous distension. Distension means getting bigger, right? It's expanding because of the right-sided heart failure. Okay? Because of the right-sided heart failure causes venous distension and can be noted in the neck veins with the patient sitting up at 30-degree angle. Starts to get bigger. All right. Now, I want to show you this right quick. But the respiratory zone, guys, is a good resource for you to look at for anything. And he uses Egan's. He's not like he's using some other school's book or anything like that. He's using the book that you use. Okay, everything he talks about comes from this book. All right. He tells you there on all his videos, he uses the Egan's book. All right, let's finish up. All right. Congenital abnormalities is the next disease. Congenital means born that way. All right. Congenital diseases may cause a right to left shunt. Blood may be unable to oxygenate. Now, right to left shunt means the blood is going from the right side and getting back to the left side without picking up oxygen. Okay. Anytime the blood goes from the right side to the left side and never picks up oxygen, that's called a right to left shunt. Okay. Anytime the blood goes from the right side of the heart, because it's supposed to do that, it goes from the right, Kelsey? It goes from the right to the lungs and then back to the left, right? When it goes to the lungs, it picks up what?
Oxygen.
Oxygen. Yeah. When blood goes from the right to the lungs, it's going to pick up oxygen, right? And come back to the left, fully oxygenated, ready to go to the body to do its job, right? But if something happens and the blood goes from the right and makes it to the left and never picks up oxygen, that's called a right to left shunt. Okay? A right to left shunt. Now, the congenital abnormality is this. This is the main one you see in babies. It's called transposition of the great vessels. Now, you'll learn that in 240. You don't have to write that. I just want you to see what happens, though. Transposition of the great vessels. The two great vessels of the heart are the aorta and the pulmonary artery. Okay? The aorta and the pulmonary artery are the two great vessels of the heart, right? Transposition means what? What do you think that means? How? Flip-flopped. When they're born, sometimes they're born with the pulmonary artery where the aorta should be, and the aorta is where the pulmonary artery should be. They're transpositioned, right? So that way, the blood pumping from the right ventral going straight to the aorta instead of to the lungs, right? And that blood is never getting oxygen, right? So when that happens, they fix you with surgery immediately at birth. They have to do open heart surgery on the baby. And what they do is they switch the aorta back to where it should be and the pulmonary artery back to where it should be, and then the baby's fixed, okay? But that's a congenital problem. You're born that way. Blood cannot get oxygenated if it's going from the right side of the right ventricle straight to the aorta. Is it ever going to the lungs? No. And it can't go to the lungs and don't pick up oxygen. That's the only place you can get oxygen is in the lungs, okay? So if the blood is, if these two are flip-flop, then this deoxygenated blood on the right side is going straight to the aorta and to the body, never picking up oxygen. That's a congenital defect, right? That's a congenital defect. They go in and they swip them out at birth. Okay? They go in, cut them open, and they put the pulmonary artery back where it should be and the aorta where it should be. Then the blood will flow like it's supposed to. Okay? They usually know that when the baby's in the mama's womb. So it's getting oxygenated through the mother. But when it come out, it's not going to work. It's got to be fixed immediately. Okay? So that's transposition of the great vessels. That will be one of the congenital issues. There's other ones that you'll learn when you get to 240. 240 is peds. That's when you deal with all pediatric stuff in 240. Okay? What's the next one? Vascular diseases. Now, these are diseases with the actual vasculature, either the veins or the arteries. All right? When you have a problem with the vein or the artery, or the first one is called an aneurysm. Aneurysm is when the vessel balloons out, like you blowing a bubble, chewing up gum and blowing a bubble. That's when the vessel balloons out. That's very dangerous because if it bursts, it can kill you. An aneurysm is when the vessel balloons out. Right? The walls of it are so weak that as the blood is going through, especially if they have a lot of pressure, a lot of high blood pressure can cause an aneurysm, right, which can kill you if it bursts. All right, so if it's in the head or in the brain, those little vessels in the head blow up like a balloon, and they shouldn't do that, right? And if it keeps on blowing up and it pops, then you have a hemorrhage, right, and death. So an aneurysm is the ballooning out of the vessels, which will weaken the vessel, right? It's going to make it weak, and eventually it will rupture and cause death. That's an aneurysm. What's the next one? Somebody tell me what number 2 says.
Arteriosclerosis.
Good. Arteriosclerosis. Arteriosclerosis is the hardening of the arteries by too much calcium. Calcium deposits can cause the arteries to become hard. That's called arteriosclerosis. So think of arterial as hard. Arterio, hard. Okay? Arteriosclerosis is the hardening of the arteries. All right. Number 3. There's another trick for number 3. What's number 3 say? Atherosclerosis. Atherosclerosis is a lot of fat deposits in the artery. Fat deposits, which cause the artery to become narrow. Okay? So all of that grease and fat that we're taking in our diet starts to deposit in the artery, eventually making the artery more narrow, which cuts the blood flow off, which is called what? Lack of blood flow, ischemia. Good. See how this is working? You got what you're eating causing fat deposits in your artery, starts to narrow the artery, which starts to then cause ischemia, right? And if you don't get that fixed, it's going to cause necrosis of the tissue, which can cause a heart attack. Okay? So arterial, the way I remember these is this, guys. Arterial is hardening, right? Arterial hardening. That's how I remember. Arterial is hardening of the vessel, okay? And then athero is fatso, okay? Athero, fatso. That's how I remember it. Think about athero, fatso, athero, fats, right? So that will be fat deposits in the artery. Athero is fat deposits in the artery. All right, somebody asked me how to spell ischemia. Here it is. Number 4, ischemia. Ischemia is decreased blood flow to an area. Right? We already learned that. That can happen for a variety of reasons, right? It can happen because of blood clots. It can happen because of low blood pressure. If your blood pressure is really low, it's not getting to where it's supposed to go. That can cause ischemia, right? It doesn't always have to be a blockage. It could be simply because your blood pressure is not high enough. It's not pushing the blood where it should go. That's ischemia. Lack of blood flow to an area. And then hemorrhage. What's hemorrhage? Somebody tell me what's hemorrhage. Huh? Loss of blood, a great loss of blood, uncontrolled bleeding. Usually a ruptured or torn vessel, like an aneurysm, right? You had an aneurysm, it popped, that causes hemorrhage. Aneurysm is not hemorrhage, guys. The aneurysm is when the vessel balloons out. That don't mean it's going to pop, okay? But if it does pop and you have a massive blood loss, that's called a hemorrhage. All right? That's called hemorrhage. Somebody gets shot or anything like that, and it hits one of them arteries or something, that's called hemorrhaging. They're going to start hemorrhaging. Somebody who gets their throat slit or tries to kill themselves by slitting their wrist, they're slitting arteries, right? That's why they do that, because they want to hit that artery. That's what's going to lose the most blood and make them die, okay? They start to hemorrhage and die. All right, now, this hemorrhaging can lead to shock. Somebody, as you ever heard, they went into shock? That's because they lost a lot of blood. That's because they were hemorrhaging so much that the body went into shock. And shock is when you have an acute peripheral circulatory failure due to loss of the circulating fluid, which is bleeding, or derangement of circulatory control. It just loses control. What happens is it shuts off the blood through the peripheral. So if you go into shock, the body will try to pull all the blood just to the head and the midsection. It's going to say, forget the arms, forget the legs. I can live without those, okay? The body will try to live even if you don't want to. Always remember that. And so when they go, if they get shot or have a car accident or leg cut off or something like that, the blood starts losing, they go into shock because of the hemorrhaging, right? loss of circulating fluid. That's bleed, right? They go into shock. The body will go into shock, which will try to shunt all of the blood to the midsection, because that's what we need. Your heart, lungs, liver, all the digestion, brain, those are the things that need to stay alive. So it will try to pull it will divert the blood to the midsection and say, forget the arms, forget the legs, they can die. They're not worried about that. The heart, the body wants to live, okay? So that's what happens when you go into shock. All right, now shock is brought about by injury, mostly injury, because you got cut, bad accident, and you start to hemorrhage, okay? Or if somebody has a baby, some women can hemorrhage when they have babies, right? They hemorrhage and can't stop the bleeding. The doctor pulls the baby out, and then I forgot what it is, but something happens up in there, and they start to lose blood, and the doctor has to do a lot of stuff to try to fix that or stop that bleeding. If not, they'll bleed out, hemorrhage, go into shock, okay? Shock can also be brought about by burns. Burns. If you get burned real bad, they can go into shock, okay? How does it look? When somebody goes into shock, they become pallor. Does anybody know what pallor means?
Is it like when you lose lots of color? Like you go clammy?
Real pasty and gray looking, right? Real pale, pasty or gray. That's pallor. The skin becomes clammy, right? And cold. Your blood pressure drops. Always remember, what did I tell you? Volume and pressure are synonymous. If you lose volume, you're going to lose pressure. If you have a lot of volume, you're going to have a lot of pressure, okay? Volume and pressure are directly related, all right? Make sure you understand that, because that's going to help you as you go along. If I see a lot of high volume, I'm expecting a lot of pressure. If I'm losing volume, then I'm losing pressure, okay? So shock comes when you lose a lot of volume, right? Because of hemorrhaging, you go into shock. So if I'm going into shock, it makes sense that I'm going to have a low blood pressure because my volume is down, okay? Low blood pressure. You have a feeble or rapid pulse. The heart is just beating fast and soft, right? Because the pressure is low. It's barely anything in there. Your respiratory rate drops. They become restless, anxiety and panicky. And then sometimes they go unconscious, right? Sometimes they go unconscious. These are all the things that are marked for shock. You can tell somebody's in shock by some of these things. Almost done. Phlebitis. What is phlebitis? Inflammation of the veins. When your veins become inflamed, that's called phlebitis. Phlebotomy is somebody who works with blood, getting veins, sticking your veins, blood work. Phlebotomy, right? So phlebitis is inflammation of the veins. Number 8, a thrombus. A thrombus is a stationary clot. When somebody has a clot that doesn't move, that's called a thrombus. Okay, so write this down. A clot that does not move is a thrombus. A clot that is mobile is called an embolus. The clot that does not move is a thrombus. But a clot that is moving throughout the body is a embolus. That's when it's dangerous, because it will get trapped in your lungs and feel like a heart attack. That's called a pulmonary embolus. Feels like a heart attack. It'll drop you. Okay? A lot of times that happens when somebody has broken their leg or had a broke hip or broke arm, right? And they're healing. A lot of times that clotting and all that the body's trying to do to heal that bone in that area, sometimes they'll have what's called a lot of blood clots in that area. And then you stand up one day and one of those blood clots becomes an embolus. Now it's traveling throughout the blood system and it's going to get trapped somewhere. Okay, it usually gets trapped in the lungs. And that's called a pulmonary embolus, which can kill you. Okay, so a thrombus is a clot that doesn't move, and an embolus is a clot that does move. Yep, they can break off and be free. Yep. All right. Of course, cardiac inflammation, we already talked about. This is simple. Endocarditis is inflamed in endocardium. Myocarditis is an inflamed heart muscle. And pericarditis is the inflamed pericardium, or the sac that the heart is in. Now, pericarditis, if not treated, will turn into cardiac tamponade. Pericarditis that is not treated can turn into cardiac tamponade. Hope y'all writing all this down. Or unless it's already in your note-taking guide. Cardiac tamponade, and that is blood in the pericardial sac, which starts to compress on the heart. Okay? So it looks like this. Your heart, guys, we already said, is in a sac, right? Called the pericardium. If that pericardium becomes inflamed, it can lead to what's called cardiac tamponade. Think of a tampon, you think of blood. Okay? Tamponade is blood in the pericardial sac. Okay? Because you're going to ask you, what is cardiac tamponade? You're going to need to know what that is. Now, what happens is, with the inflammation of the sac, when blood starts to get in between the sac and the heart, it starts to fill up with blood. The sac does not stretch. Okay? So the more the blood fills up, the more it's going to start to compress on the heart. See that? The blood is inside of the sac, but the sac does not stretch. So if you keep on bleeding inside of that pericardium, it's going to start to press on the heart, right? Then you got more problems. That's called cardiac tamponade, when the blood starts to compress on the heart because it has nowhere to go. Okay? It can't go out of the sac because the sac does not go anywhere. Same thing as if your head starts to bleed. If you have a head bleed, can the skull stretch? No. So if blood starts filling up in your brain, it's going to start pushing the brain because it can't go anywhere. It can't go out. That's from that drill a hole, get that blood out before you die. Okay? So that's cardiac tamponade. When the pericardium becomes so inflamed and starts to bleed, right, it can cause pressure on the heart, which is cardiac tamponade. All right. What about rheumatic fever? Rheumatic fever, very rare that you see something like this. But rheumatic fever may damage the heart valves or muscle, causes a decrease in blood flow. You don't have to really know much about rheumatic fever. It's just something they're talking about. Very rarely do you even see that in America. Okay. But what about angina pectoris? What's that mean? What's angina mean? Huh? Say it again. Pain. Angina means pain. What's pectoris? What muscle is that? Your pec, your chest muscle. Your pecs, right? I used to move mine back and forth. Right? Your pec muscles, right? Your pecs. So if your chest muscle is sore, that's angina pectoris. Simple. Pain of the chest muscle. All right? Pain located over the heart, either the left shoulder or in the jaw, right? Due to decreased blood supply. Oh, this is the pain you're feeling. When you start to have ischemia to the blood, to the muscle, it starts to hurt, right? Ischemia of the coronary artery. When that coronary artery starts to become ischemic and blood starts to become less to that muscle, to that heart, you're going to start feeling pain. You're feeling it die, okay? Angina starts coming after ischemia, okay? And you can feel it over your heart area. Sometimes you can feel it in your left shoulder pain. Sometimes people feel it in their jaw. They think their tooth is hurting when it's actually your heart, okay? So be careful in how you treat your heart. All right, a little bit more and we'll be done. Let me see, you got congestive heart failure. Yeah, that's it. Last one, and we're done with cardiac A&P. Congestive heart failure. This is a left side heart failure. Write that down. Congestive heart failure is left side heart failure. It's caused by if somebody had a heart attack or ischemic heart disease or cardiomyopathy. It's basically impaired cardiac pumping. So congestive heart failure is the left side is not able to pump it to the body like it should, right? And what's going to happen if the left ventricle can't pump? What's going to happen with the blood? It's not going to get there, but it's also going to start doing what?
Start to back up.
Start to back up. So this is the left side now we're talking about. Right side is cor pulmonale. Right side of heart failure is cor pulmonale, which happens because of some kind of lung disease. Well, congestive heart failure can happen from a previous MI. Somebody had a heart attack or some kind of issue like that, which caused the left side to become weak. Now, the left side is the one doing the most work. It's got to pump blood all the way to the body with every beat. So if it gets weak, it's going to start being weaker. The blood is going to start to back up in the left ventricle, start to back up into the left atrium, and then start backing up into the, what are these?
Pulmonary veins.
Pulmonary veins.
No, pulmonary.
Yeah. Gonna start backing up into the pulmonary veins and then back into the, from the pulmonary veins, what's before the pulmonary veins? The lungs. It comes from the lungs to the pulmonary veins. So then you start to see an X-ray with fluid around the heart and in the lungs. Like, where's all that fluid coming from? That's congestive heart failure. You can see it in the X-ray because the blood and now the fluid is coming from the ventricle, backing up into the left atrium, backing up into the pulmonary veins, and dumping back into the lungs. They can't breathe. You can hear like gurgling sounds in just regular breathing. They're drowning in their own blood. Okay, that's congestive heart failure. We're gonna have to give them diuretics, all kind of stuff to try to fix that. Okay, so CHF, which is congestive heart failure, that's CHF, right? CHF is congestive heart failure. It is also known as left side heart failure due to high blood pressure, ischemic heart disease, heart attack, anything that's happening like that can cause that left side to become weak. And if it can't be pumped like it's supposed to, it's going to start backing up. And you can see it in the X-ray. It's like a mirage of water around the heart and the lung area, edema, right? Mm-hmm. Mm-hmm. To full strength medicines and all. Yep, they got to do that. Mm-hmm. And that's good that you were able to get your function back, right? Get your function. And a lot of times we can see if somebody has that by either the X-ray or we do what's called an echo. Somebody gets an echo done, they can see is your left side pumping at its full percentage. Some people's left side is only doing 30% of what they should be doing. They're going to be hurting, and not only hurting, but just tired, sluggish. You know, you go up the steps and be tired. You know, you're not your 100% self until you can get that heart back to how it's supposed to with inotropic drugs, diuretics, diet, things like that help get that heart back right. Okay. So if you didn't think about your diet before today, really consider your diet, what you're putting into your heart, because this is it's all you got. And you see so many things that could be wrong with it. And that's just the skirt. We're not even doing cardiology, right? This is just few things that respiratory has to deal with. Because you have to know these things, guys, in order to treat your patient. You don't just do breathing treatments. You got to know what's going on with their heart, what's causing that, because that can cause a problem with your lungs. CHF causes a breathing problem because the blood is backing up into your lungs. So you need special medicines to get that fixed so you can help what you're going through, okay, what you're trying to fix. So it's all about cardiopulmonary therapy. That's what you are, a cardiopulmonary therapist. All right. That is everything, guys, for cardiac A&P. We are now complete with cardiac A&P. Your homework for tonight is to go through Canvas and look at the blood-borne pathogen, okay? bloodborne pathogens video, and I think there's a little thing that says, yeah, I watched it. And that's going to be your attendance for the day. So I'm going to show you how to get to it. All right. You're going to go to modules. All right. Go to your modules and see, make sure I got it open for you. Go all the way down to, there we go. The one that says bloodborne pathogens. Let's see, where is it? Right here. It says bloodborne pathogen training. I'm going to open it up for you. All right. You want to look at it. I'm going to change the date and everything on it, but you want to open it up. Okay. Well, you go to bloodborne pathogen and open up the bloodborne pathogen training. Okay. Go to the modules, go down to where it says bloodborne pathogen training. And then there'll be a link for you to select it. You'll select it and open it up. It's going to be a video for you to watch. Okay. A video for you to watch and then answer the question. I watched this video. That's it. Once you say yes, that's your attendance for today. Okay. I'm going to go
I don't
in.
see it on mine, Mr. McCarthy.
Well, I just, you
Yeah,
might
I
have
don't
to,
see the link online.
you might
Okay.
have to, you may have to refresh your screen because I just published it. It wasn't published. I just published it. So you'll probably have to refresh your screen so that you can see it. I'm going down here now and change the date. The date is due. All right, January. Today is the 11th, so 1/11, January 11th by midnight. Boom. I just changed it. Change this over here, available. January 11th. All right, until 11:59 p.m. All right, now let me save it. Now, it is now saved. That's your homework for tonight. You go over here to module. And you go down to bloodborne pathogens. Okay?
It's saying that the quiz is locked now until at 11:59 p.m.
Go down to bloodborne pathogen. I just changed it to today's date. You might have to refresh your screen again. Just don't try to do it while I'm talking. Just look at what I'm showing you, and then you can do it when I'm done, okay? Because I'm changing things as we go, and it's probably showing that on your screen until you refresh your canvas, right? I just changed it to make it available today until 11:59. All right. Now I'll make sure it's available. So when we get off the class today, it'll be available for you to do. That will be your assignment for tonight. Okay. And that will be your attendance. Tomorrow is everybody here during your time. Alpha students, be here at 1 o'clock, not 1:15, not 1:30, not 1:40. Be here at 1 o'clock because we got a lot to do. Okay. Omega students, you come at 4 o'clock on time. Be here at 4. All right. And that way we can get everything done. You have to also get your shots tomorrow. So you're going to come in, take your test, go get your shot, and then go to lab and go home. Okay. If you already got your shot, then when you come do your lab and your test, you're done. Okay. That's Tuesday. Wednesday, we start RT210C, which is pulmonary A&P. And now we got to jump all into the lungs and learn all about the lungs. All right. So we got a lot to do. Study tonight. I hope you studied over the weekend because the exam is tomorrow. All right. I will see you guys tomorrow at your respective times. Make sure you're dressed out. Your lab coat. You need a watch. You need your stethoscope. If you have the little pulse out thing, bring that as well. Okay. Fully dressed out for lab. We will be.
I don't have my uniform until tomorrow.
Okay, well, you can get it tomorrow because lab is not till 1. And so try to get it tomorrow morning when they get here. Whatever you got to do. It's not a big deal. I mean, if you don't have it, you don't have it. But everybody that has their uniform, you need to make sure you're fully dressed out, okay? All right, I'm going to get off of here now, and I'm going to go through, make sure that that bloodborne pathogen is open for you to take this evening. That will be your attendance for today. If you didn't turn in your homework from this weekend by Sunday and didn't turn it in by 1 p.m. today, then you're absent for Friday. And I think it's only one student that didn't do it. I haven't talked to her. So other than that, I'll see you guys tomorrow fully dressed out. Study, study, study.